I think people, when they understand what can happen with socialism and more government control, they realize, no, that's not the route we want to go. Can it be expensive care? Can pharmaceutical products be expensive? Yes, and we can deal with costs through competition across state lines, nationwide association plans, price transparency, which helps people shop to drive down the cost of health care, and then things like high-risk pools. So everybody in our country, no matter their condition, they could have expensive pre-existing medical needs, they'd get timely quality medical care, but not everybody else would have to pay for it through their premiums. Those types of things that we can do more market-oriented make a lot of sense.
We are joined today on the Daily Signal podcast by Congressman Jim Hagedorn of Minnesota. Congressman, thank you so much for being with us today.
Well, it's great to be with you, Rachel.
Well, thank you for being here. So to start off, your district includes the Mayo Clinic, and you're very passionate about health care, free markets, and how Mayo Clinic has been able to grow there because of the free markets that you have. Can you tell us about that and why socialist policies would harm the progress that is there?
Sure. Yeah, southern Minnesota is home to many great institutions of medicine. We have some fine rural hospitals, including also then the Mayo Clinic, which is the preeminent institution of medicine in all the world. You know, the quality that we have in the United States for medical care is second to none. And I don't ever want to see that degraded. And the opportunity that we have to receive biopharmaceutical cures that are literally saving people's lives and letting people live the best life possible. It's just happening every day, all these cures that are coming out. So making sure we protect that is really important. It's had, the Mayo Clinic also has, in a lot of our hospitals across the country, an enormous economic effect in and around them. We have like 40,000 people that work at Mayo and Rochester every day, and there's 100,000 people across my district, direct and indirect, employed by medical care. So it's really something.
Well, you're particularly passionate about Mayo Clinic and the care they give because personally for you, you've been receiving cancer treatment there. Can you tell us a little bit about that and why you are so passionate about Mayo Clinic?
Well, about a year ago, I was diagnosed with advanced kidney cancer, and I'm very fortunate that they found it before I had any real symptoms. And since then, I've been receiving treatment at Mayo Clinic. My doctor, Pagliaro, just a terrific oncologist. All the people there, the technicians, the doctors, the nurses, very caring folks. And it's like that, again, like I said, at all of our rural hospitals across the district and many fine institutions across our country. But to have that opportunity to get in quickly, to be able to start treatment quickly, and then to have pros that know what to do, it's been something that saved my life. I mean, the treatments are going well. Cancer's disappearing, going away. I never missed a day of my job in the last year. And some of these immunotherapies, which is what I'm on, are just game changers. The treatment allows me my body to identify the cancer and then have my own immune system go in and kill it. And so, like I said, very little symptoms, side effects. I'm very fortunate, and the people out there have been so supportive, and I appreciate that.
Well, thank you so much for sharing that with us. Looking at the good work Mayo Clinic does, how would that be hampered by more socialist policies coming into your state? For example, Medicare for All that lawmakers both in the House and Senate support. And how would that be hampered by the good work Mayo Clinic does?
So good work, I think, of all of our institutions of medicine in the United States. Really, when you look at Medicare for All and things like the public option, that's going to put more and more people on government insurance. And government insurance reimburses our doctors and hospitals at a lower rate. Usually for Medicaid, it's about 25 cents on the dollar. Medicare up to about 40 cents. But the way hospitals and doctors make up the difference is they have people on private insurance that come in and pay more. And so, Medicare for All public option is going to lead to more and more of this government, and it's going to take away ultimately health insurance from people who get it through the private sector, 180 million people. That's not good. It's going to take money out of the system for our doctors and hospitals. That's not good. That's going to degrade care. It's going to force people to have longer waiting systems. We're going to end up like they are in many other countries like Canada and United Kingdom. I mean, I bring up United Kingdom because the drug regimen that I'm on that was approved by the FDA within the last year, that's not even available in the United Kingdom. They rejected it due to cost. And so there are lots of people around the world who are suffering, not even able to get the most advanced treatment because of socialism. And then on top of all that, when you look at the difference between socialist systems of medicine and our free market system, which is unfortunately very bureaucratic and highly regulated, some of that due to Obamacare, but the difference is a person in my situation can get diagnosed by a specialist and receive treatment within weeks. In these socialist countries, it can be months and months, and often by the time the treatment starts, it's too late. It's just terrible.
So, given that reality, what would you say to people, maybe young people who are fans of Congresswoman Alexandria Ocasio-Cortez, who think Medicare for All would be a wonderful solution? What is your message to them?
Well, the VA system that we have in the United States is the closest that Medicare for All would resemble. We'd ultimately get to that point, and we want people to have choice. And if you don't have choice and options, and you have to rely on the government, which doesn't always do a very good job in a lot of areas being efficient and responsive, you're going to be in a position where people aren't going to have much choice and they're not going to have much hope. And what we want in the United States is if there's a problem with somebody, we want to treat that problem and do everything possible to give people long life and the best life possible. And that isn't the case in these socialist systems. And I think once people kind of look at that and feel it a little bit and talk to people that have been in circumstances like mine and many, many millions of others across the country, they might come to a different conclusion.
What do constituents in Minnesota think about these policies when they hear people talk about Medicare for All? And I'm sure some of them have received really great care like you have at Mayo Clinic. Are they skeptical of it because of how well Mayo Clinic is doing, and that's a shining example of what the free market does for healthcare?
Well, I mean, when you look at what's going on in Rochester, Minnesota with Mayo, we have hundreds of thousands of people from around the world that travel there every year for care, because it is the finest care in the world. But again, we have all these wonderful institutions of medicine, the rural hospitals. People are getting quality care across the United States, and I think people, when they understand what can happen with socialism and more government control, they realize, no, that's not the route we want to go. Can it be expensive care? Can pharmaceutical products be expensive? Yes, and we can deal with cost through competition across state lines, nationwide association plans, price transparency, which helps people shop to drive down the cost of health care, and then things like high-risk pools, so everybody in our country, no matter their condition, they could have expensive pre-existing medical needs, they'd get timely quality medical care, but not everybody else would have to pay for it through their premiums. Those types of things that we can do more market-oriented make a lot of sense. But right now, the Democrats and Republicans, they both agree on this. Obamacare hasn't worked. Republicans said it hasn't worked from the beginning. Democrats say you need to go further. And what the Democrats offer with the Medicare for All and the public option is going to destroy the quality of medicine that we have, and it's going to, unfortunately, hurt people and curtail people's lives down the road. I'm going to fight that every step of the way. I'll never vote for it.
Well, thank you for your leadership on that. Switching gears a little bit to trade, you attended the signing ceremony for the USMCA at the White House,
Yeah.
and it passed both the House and the Senate. There was bipartisan support. What is your perspective on how this will foster free trade?
Well, I'm glad that the bipartisan support materialized at the end, but people like myself, I was out there fronting for USMCA for about 10 months. We carried our little sign in parades and everything else, had the Secretary of Agriculture out to Farm Fest in Minnesota, and he held up our sign. I mean, we just wanted everyone to know that 48% of trade in Minnesota, ag trade, goes to either Canada and Mexico. So to augment that in any way is going to be a good deal, especially for our dairy farmers who weren't even included in the original NAFTA. But I also thought that passage of the United States-Mexico-Canada Free Trade Agreement was going to help us build momentum for other deals with countries like China. We've seen that with China, phase one. We want to get to phase two. We hope they buy our ag products, and President Trump's holding on to the tariffs to make sure that they comply, and we can get to enforcement later. But the deal with Japan on pork and beef, that was very, very good for our farmers, especially a livestock heavy district like mine in southern Minnesota. And then you're looking at the United Kingdom. They had the vote with Brexit to get out of the European Union. That was great for freedom, great for liberty, great for our relations, but also great for trade between our two countries. Vietnam, also a deal with India. The president was just in India. And people say, well, how's that going to help southern Minnesotans? Well, India might want to purchase as much as 1 billion gallons of our ethanol. That's going to create demand. That's going to help support prices, and it's going to help our rural economy. So I'm going to continue to be pro-trade, and we want good, fair agreements with other countries, but we need to open markets and have opportunity for our farmers, manufacturers, and others to export around the world.
Well, thank you for sharing that perspective. You've also been busy working with Secretary Sonny Perdue, he's the Secretary of the Department of Agriculture, on a program that incentivizes the sales of renewable fuels and expands ethanol availability. You mentioned ethanol very briefly, but can you tell us a little bit more about that project you're working on?
Well, the Secretary has actually been very proactive in making sure that we can continue to promote the biofuels industry, and I support that because it helps with excess production, and in many ways these additives are making things cleaner and helping the overall economy, especially in rural areas. You know, if there was one area of disagreement with the EPA and the President's administration, it was the way they were giving out waivers for small refiners. It wasn't exactly what the Congress intended. It was undermining the ethanol and biodiesel program. But the President's promised that we're going to blend up to 15 billion gallons of ethanol and 2.4 billion gallons of biodiesel. And that's a good thing. And we're gonna hold the EPA's feet to the fire and make sure that the renewable fuel standard is implemented the way Congress intended and the way the President has directed.
We've been talking a lot about trade. We've been talking about agricultural policy. If there was one issue additionally that you think Congress should be working on, what is that?
Well, we are working on it. I've been leading to let people know about another virus that's we all heard about the coronavirus, and rightly so, and we're concerned and taking steps to try to protect our country and help people around the world. But there's the African swine flu, which has devastated the hog population in China. This has been happening over the last year. Half of China's hogs or more have been slaughtered because of it, and it's affecting people in Vietnam, Thailand, the Philippines, and it's into Europe now. And so a great opportunity for our country. We can export more pork products, probably poultry as well, but what a challenge. How do we keep that from getting into the United States? So we worked on a bill. The Senate passed one over to us a couple weeks ago. I spoke on the House floor, and that's going to augment the number of inspectors and beagle brigades at our points of entry to try to sniff out, find these pork products, and keep them from coming into the United States. That's the way our pork would be affected. And people laugh at the beagle brigades, but they're really good at sniffing out the pork. I said they're so good we should take them down to the Appropriations Committee and to get to work on the deficit like that. But, you know, if the African swine fever makes it into the United States, it'll affect more than just the pork producers. It'll be our corn, it'll be our soybean growers, it's going to be our packers, the truckers, everybody on down the line to Main Street where they'll have less money. And then the American people will suffer because the price of our meat products will go up. So, yeah, we're very concerned about that and want to raise awareness of it, and we're going to continue to do what we can to protect our food supply and our farmers.
Well, Congressman Jim Hagedorn of Minnesota, thank you so much for joining us on the Daily Signal podcast.
Oh, it's a pleasure to be with you. Thank you.
Thanks for being here.
All right.